Well, good afternoon, everyone. Thank you for being part of our community chat today. I'm Tim Gillette, the Operations Manager for our Child Welfare and Self-Sufficiency programs at the Oregon Department of Human Services. And I use he, him pronouns. I will be helping to facilitate our community chat today. I'd like to start by having my colleagues on the Child Welfare Executive Leadership Team introduce themselves. April, would you like to go first?
Sure, no problem. Thank you so much, Tim. Good afternoon, everyone. My name is April Flint Gerner, she, her pronouns. I am the ODHS Child Welfare Director.
Thank you, April. Lacey, would you go next?
Sure. Good afternoon, everyone. Lacey Andreessen. I use she, her pronouns, and I'm the Child Welfare Deputy Director for the division in the Oregon Department of Human Services. It's great to have you all here.
Great. Alicia?
Good afternoon, Alicia Cox, Assistant Deputy Director of Strategy and Innovation, she, her pronouns. So glad that you're here with us today.
Wonderful. We've got a few more people still joining, so we're going to take a minute while folks are still coming in. While we're waiting, we're going to post a poll for you to take. So if you could let us know what you enjoyed most this summer, that'd be great. Oh, looks like. There we go. There's the right poll. We got a great team back here helping us out. I'm glad we were able to grab that. So yeah, if you could let us know what you enjoyed most this summer, and then I'll start sharing some of the logistical details for this afternoon's chat. First of all, our meeting is being recorded and ASL and captioning are available. If you'd like to utilize the live captioning, please click on the CC button that's located at the bottom of your screen. For real-time interpretation to ASL, please see the pinned video on your screen. And my understanding is there is a way to adjust the window size in Zoom if necessary. I'd also like to mention a few housekeeping details. First of all, in order to interact with us, please use the Q&A function at the bottom of your screen to submit your questions. We'd love to hear your questions, and we are planning on spending the last 15 to 20 minutes of our webinar answering some questions that we've already received, as well as hopefully some of the questions that you add as we go along. Any questions that we're not able to get to, we will make sure that we follow up on and address those questions as well. This webinar also is being recorded, so that will get sent out after it is over. Again, thanks for joining us this afternoon from all over the state. And during our time today, we'd like to provide you with some updates on our vision for transformation work and speak to topics that are most relevant for our community partners. To kick us off, I'd like to give you a brief update. You may remember that our colleague, April Flint Gerner, has been serving as the interim child welfare director for the first half of 2023. We were very happy to announce in July that April has been named the child welfare director. April previously held the role of Deputy Director for Equity, Training, and Workforce Development and has many years of public service, focused on system change on behalf of children, youth, and families, and the well-being of communities. April is a great fit for this role due to her leadership and vision in the areas of equity and working with community to find creative solutions for families. With that, I'll hand it to April to speak a bit more about her background and our priorities.
Thanks so much, Tim. Again, I'm April Flint Gerner, she, her pronouns, and I want to thank all of you for taking the time out of your busy schedules and lives to spend time with us today for this community chat. I also wanted to take a moment to really appreciate Kinship Care Month and all kith and kin and relatives who step up to make a difference in the lives of children and families and the broader community. I know that some of you, already from my time being the interim director, that we've known each other or that we've interacted with each other. And you all knew me in my role as the deputy director, but I thought I'd share a bit about what drives my passion for child welfare as I've stepped into this new role. I'll start with some of the really important things about me. First, I am an obnoxious Ducks fan. Anyone who spends a few moments with me knows that to be true, and I'm looking very much forward to attending the game this Saturday. I am a proud social worker. I'm a dachshund lover. And I am a people person. I'm an extrovert. I love building relationships with people. It's what drives me. I moved to Oregon at the beginning of the pandemic, although I deny any culpability that those two things are connected. Over the last 25 years in the public sector, more than 25 years, but I don't want to give you too much information about my age. I've really specialized in workforce and adaptive leadership development, in building strong relationships with community to help lift their voice into the work, and really coaching leaders around system transformation. I spent the majority of my professional career in California, and then I spent a couple of years in Nevada working with child welfare before moving to Oregon. Early in my career, in the mid 90s, I got grounded in child welfare by working in group homes and running teen centers and running tutoring programs. And I saw that there was so much room to grow around, some of the particular young people that I was working with. And many of them had been experiencing or had experienced the foster care system. Now, for those of you who know about the beginnings of the independent living program, I was one of the first ILP professionals in California. The first programs were all about acknowledging we were losing these young people and young adults and weren't providing the right opportunities for them to grow into resilient adults. And I remember sitting in a courtroom for the first time with a juvenile court dependency judge that I actually think still may be presiding right now. I was in my mid-20s and I was not much older than the kids that I was serving and that I was working with. And I saw that they were scared. I saw that they were, did not trust the system. And I remember this judge asking a young person about their dog or their horse. I couldn't remember which animal it was because it's been a while. And I do remember thinking, how does this judge know about this child's pet? And I came up with this brilliant idea that I wanted to be a juvenile court judge because one, I wanted the ability to have what I thought at the time was power to impact change for children, but to do it through the power of relationship. What I really learned was that that power exists in all different places and spaces within the system. Every single person that touches the lives of children in our communities has power to influence them and impact their lives for the better. I decided at that point that I would go and work in every child serving system that I could. And it's what started a long journey in terms of working in all of these child serving systems. I never thought I would get stuck in child welfare. And here I sit many, many, many years later, having worked in all of those systems that I wanted to, but still coming back to child welfare. And the reason is because I'm obsessed with the idea of improving outcomes. I am obsessed with this idea that the system does not have to be as traumatizing as it was to those young people that I was working with so long ago. And I really saw the data showing how far some communities were from good outcomes. I wanted to understand that, and I wanted to understand the dynamics that it required to change it. Now, I ended up staying in child welfare, but that journey led me through many aspects of the system where I started to get really curious about how system change worked. One specific example, when I was an ILP worker, I was supporting the educational needs of young folks who in one moment got no support and in the next moment were now eligible for lots of supports. And so being one of those first workers in the state, I had an eligible caseload of 1,400 children that I was supposed to be supporting the educational needs for, just me. The majority of those children that were eligible for aftercare and transition aid services for education supports were Black and Brown young people, and almost all of them had experienced poverty at some point in their lives if they weren't experiencing it at that moment. The system as we know it simply has not been working to make sure that poor families, that Black and Brown youth and families have the same opportunity to get to good outcomes as people with more resources or people who are not from those backgrounds. I question daily, do we need a system to step in and separate children from families when they're in crisis? I think that we can do better by helping those families stabilize themselves early on. And that really requires us building partnerships with them. It really requires a new way of thinking. And this is why I'm really excited about the work that we're doing alongside our self-sufficiency program to really look at the root causes of poverty and child maltreatment. I am really excited about what's happening in our family preservation demonstration sites because we're getting to learn what happens when we get concrete supports in the hands of families as a prevention strategy. My why and what excites me is really based on that understanding of the system hasn't been working as we've wanted it to. And I am committed to continuing to do my part to help it transform. We're not rebranding. We are talking about transformation and really bringing to question the values that undergird the child welfare system. And so we're really excited to continue the work of the Vision for Transformation. We know that we are in a time of major change, and I think that that requires more transparency, more humility, and more accountability. And that's why we hold these community chat sessions. When I accepted the challenge to step into this role, I wanted to be sure that I was building community accountability into the future of this role. To me, that means being in regular dialogue with tribes, partners, and community, as well as staff. We want to continue to hear from you about what's on your mind, and we want to keep the doors of communication open with you as our partners. So I wanted to just kind of close by saying thank you to those of you who are attending, those who are bringing good questions to the forum. Before we dive into updates and questions, I just want to, quickly talk about some of my priorities as I step into this role. Continuing to enhance safety and work alongside communities to build safety for Oregon's most vulnerable communities without an over-reliance on separation. Making sure that we're lifting up the voice of community to help us understand how well we're doing or not. Honoring tribal sovereignty and deepening our engagement with Oregon tribal nations and tribal nations across the nation when we are interfacing with their children. Leading with equity and centering the voices of our staff and communities that have experienced identity-based harm and traumas interfacing with our system. Advocating for and investing in our staff and leaders to make sure that they feel confident, valued, and competent. Working with our provider network and system partners to ensure that families get what they need to prevent foster care whenever possible and to get families back together quickly when it is necessary. And lastly, advancing our technology and our data tracking resources so that our work is more informed and easier to do. My hope is that you see the Vision for Transformation and my priorities. It's my intent to work every day to help us live into it so that the public and staff confidence is restored and that we can continue to do great work with Oregon. I thank you today for your partnership. I know this work is very challenging and at the same time, incredibly important. Sometimes we forget to thank each other. And so I really want to express my gratitude for your advocacy, for you continuing to hold us accountable for better outcomes, and for your time and dedication to children and families in our community. Thank you so much. I'll pass it back to Tim.
Thank you, April. I get to hear you talk about this stuff every single day, and yet it's always great to be reminded about our priorities and our why. So thank you. Next up, Lacey's going to share some updates about family preservation and the importance of Kinship Care Month. Lacey.
Thanks, Tim. Good afternoon, everyone. Again, Lacey Andreessen, she, her pronouns. Really great to be with you all today. We'll start with an update on family preservation. You hear me talk about this often when we're together, and it's really because it's at the core of the vision for transformation. We believe that children do better and stay better growing up with their family. We focus on it so much in addition to that because we have clear data that demonstrates that children who are with their family have better outcomes in safety, well-being, and in permanency. We have a technical assistance partner, Casey Family Programs, and they did a study in 2018 called Data to Practice that demonstrated that for young people in Casey placement supervision services, the more time they were with their family while they were in care was associated with better outcomes like fewer critical incident reports, better school achievement, and physical and mental health, just to name a few of what they indicated. It's why we honor Kinship Care Month in September as such a crucial part of child welfare and child's well-being. Relatives are often key to surrounding children with care, whether they have experienced trauma or not. Families in many cultures go far beyond what's biological. My son, for example, has 5 women who he still calls auntie because they are my closest friends and they are not someone who is blood relative to him. It includes anyone that you deeply trust in your neighborhood and community. And sometimes it's easy to forget the sacrifices that families make when they step into this role for their grandchildren, nieces, and nephews. And it's really so important. It makes such a difference for kids and families. According to Generation United, about 7.8 million children across this country are living in households that are headed by their grandparents or other relatives. I'm really grateful for our partnership with the Oregon Kinship Navigator Program. OKN is providing legal help, support groups, and services for relative caregivers in this state. A couple of updates on the expansion of family preservation. We're working to define how we support a family preservation approach, rather than it being a program or an intervention, but a whole approach in working to make sure that we're managing safety and safety threats that does not need to equal separation of a family. We are working really hard to do better to support our focus on child safety without over-relying on separation for the purpose of placing children in foster care. Over the past year and a half, we've piloted demonstration sites across the state, learning from what's happening there. We're expanding into more communities and really focusing on cross-system partnership, specifically with our sister agency Self-Sufficiency, but also other community as well. And then looking at how we are able to build safety while a child is remaining in their home. We've seen that shift naturally as well. I think you heard April mention this, that the impact of poverty is directly related to child welfare and child welfare outcomes. We are focused on making sure that we're not using our system to further marginalize poor community, because being in poverty is not an allegation of abuse. We're looking now to continue to expand and focus in partnership with community, tribes, and with staff in the state, and to make sure that, like we said, children can stay together safely while we are keeping them in their homes. In addition to the sites where we've been in family preservation, we've expanded to the Alberta branch in Multnomah County. Multnomah is a county that's large enough that they actually have 5 child welfare offices. So Gresham's been on board, Alberta is joining this. We also have Douglas County that has been a site. Polk County is being added. Coos and Curry counties, and Jackson and Josephine, and then finally Washington County. It's as we're moving into those counties, we're not taking a cookie cutter approach. We're looking at really specifically for that community, for that town, what can we do to meet the family's needs specifically for where they are and what they have. We're also working on an additional amendment to our federally approved Family First Prevention Plan. That is the plan that articulates how we can draw down federal dollars to help support the work of prevention from children needing to be separated and placed into foster care. We have started with this population that we're serving now. That is where we are managing safety while children are in their home after abuse has occurred, and are exploring what's it going to take for us to be able to continue to use those services to actually administer primary prevention rather than after something bad has already happened for a child. Couple things that are important to me that happened as a result of the legislative session, and I think are most relevant to you all as our community partners. Many of you ask in questions as we're in this space together about what are we doing to support providers, provider rates, higher levels of care, system capacity for children and young adults in this state. And I'm really pleased to report that we advocated for and received a huge investment in our behavior rehabilitation services, commonly known as BRS, in the rates and the rate structure of those providers. They got that increase as of July 1. And while I would never say we are exactly at the highest level or mark that we want to be, it's encouraging to see the increase in the progress. Another very important piece of legislation that we advocated for and that was passed was Senate Bill 209. 209 allows us to keep the information about children in regards to their sexual orientation, gender identity, and expression confidential in the discovery process of juvenile dependency court. Historically, that information was discoverable, and in moving forward with identifying children's needs, protecting them, protecting their rights, we're excited that we were able to make that change so that we can keep that information confidential unless or until they or their attorneys are ready to indicate that we can share that. And then lastly, I would just like to make sure that we highlight the work of Senate Bill 865. Senate Bill 865 really made two changes to the current statute. The first is at the beginning of a case, and as we initially contact parents and their relatives, we're going to be required to provide written notification for exactly what happens when a child is placed in a non-relative resource home. Why that's important is because there is a group of resource parents that become current caretakers. There's two different routes to becoming a current caretaker, but they actually are considered differently and together when we're doing adoption selection. So we want to be sure that parents and relatives understand the impact of what happens when one of their relative children may be in the process of us planning for adoption for them. To echo April, I deeply appreciate your time with us, your willingness to come to the table with us, and I continue to look forward to what we can be doing together. Back to Tim.
Thank you, Lacey, for that. Alicia Cox has been leading the great work in our continuous quality improvement program. Alicia, do you have an update for us on recent progress?
Yes, Tim, I always have an update about our continuous quality improvement efforts, or CQI. That's the acronym I'll be using throughout, because as someone who has a speech impediment and lisp, continuous quality improvement is a lot to say more than once, and saying it fast, it can give me a little stumble. But with our guiding principle number 3, which is utilizing our data so that we're using informed decision-making, it is absolutely part of our vision for transformation. We need to modernize our technology to get the reports and the information we need as we work through our improvements in our case practice. So I would like to provide an update on our CQI improvements. We have been underway in quite a few districts across the state. Last year in June, we rolled out for the first year, and it was in District 12, 6, 14, District 1, District 2, Gresham and Midtown, District 3, 13, 14, and District 11. So of course, if you heard your district, you can virtually clap or raise your hands and give yourself a pat on the back, because we've seen tremendous efforts in improvements in just these sites that we had in the last year. I want to share that there was an 87.5% improvement from baseline with those sites in this last year in rollout. So for those first 3 quarters, you had the baseline information and the integrated community efforts, the partnership with persons with lived experience, the child welfare workforce, partner organizations, tribal relations, tribal representations, and tribal nations showed up so strongly in each of those districts to work on improvements for our children and families. And today we celebrated District 6, Douglas County. It was the start of their 2nd year in the continuous quality improvement program. It was invigorating to look at their data from the past year and the improvements over the course of the last 12 months. It was a phenomenal amount of work that has gone into it, but also the outcomes and the data that we're seeing. Their parent face-to-face contacts improved tremendously in the last 12 months. Back in 2019, there was at 36%. Then in 2022, when we started our CQI, it was at 50%. And then this year in 2023, the data says that we're at 80%. So just phenomenal amount of work. The intention and passion and commitment to improvement has been a new and invigorating process for child welfare. We're opening up our doors so that we have community persons, anyone who's in part of the child caring community can come in and look at our data and understand that we're here to partner, to best strategize and work together on our improvements. So I appreciate the opportunity to report on these efforts. It's really the work that you all have been doing, the work of the CQI program, the work of the consultants who are in the districts working with districts, and all the persons who really have elevated and prioritized improvement. The introduction meetings, of course, with Alberta and East and Gateway were last week or 2 weeks ago. And again, if you were in the Portland area and you attended those meetings, appreciate your partnership in working through the data and identifying some possible strategies. If you are interested in our CQI efforts and you sit in a different position or you have lived experience or you're just curious about our data, we do invite you to participate in the kickoff meetings or the strategy meetings for our continuous quality improvement efforts. You can reach out to your caseworker and ask about it when the CQI cycle is hitting your site, or you can email cwcqi@odhs.oregon.gov. And that will be dropped in the chat. So you can email the CQI team directly, say you're interested in being part of the advisory committee, which reviews all the strategy and action plans for the state and provide input, or you can actively be part of the sessions in your local area. And if you are interested in hearing more about it, we do provide updates in our community chat. So hopefully we'll see you in the next few months to hear more about it, or you can reach out to the CQI team and check in about your local area to hear what we're doing. Another update that I'd like to share is in August, the Tribal Relations CQI analyst and the CQI manager met with the Confederated Tribes of Umatilla Indian Reservation and the Department of Children and Family Services director, and a caseworker came along, and I'm also with our senior ICWID manager and our regional specialist for D12. And that is making those intentional efforts to connect with the tribes in the particular districts, because they're already doing family preservation. They already know how to make those intentional improvements, and it's seeking to learn more about their work and to partner on our improvement strategies within child welfare. So I appreciate the efforts and the ongoing work that we have with continuous quality improvement. If you have any questions, again, you know how to get a hold of us. And back to Tim.
Perfect. Thank you, Alicia. Lacey, I know you've been working on some aspects of the most challenging issues we face today, including temporary lodging. Could you give us an update on where we stand as a state?
Sure, Tim. This is true. In these spaces, we talk a lot about the innovation, prevention, strategizing around preservation, and it's important that we acknowledge and know that our communities are experiencing what we are communicating, which is capacity gaps within the child serving continuum, particularly for kids with really complex needs. While we are still having children and young adults in temporary lodging, we also are making progress. And it's really important for me that we remember that half of the equation. In spite of the pressure, we continue to prevent about 75% of children who are at risk of temporary lodging in the state from entering TO. We're tracking closely the data around the children who end up needing to be in temporary lodging for a period of time, because that's what's really going to continue to help us inform where we need to grow out capacity, services, supports. About 83% of our kids in temporary lodging have immediate high need, and they're based on really high risk behaviors such as self-harm, physical or verbal aggression, substance use disorder, eloping from their placement, and or sexualized problematic disorders, problematic behavior. We have a range of recommendations that we're looking at across the system of care. And it's an issue that's faced not only by Oregon, but by states across the country. We're doing technical assistance with other states to problem solve and brainstorm together. Some of the things that we continue to explore are adequate and timely access to residential treatment and the capacity in all areas of the child serving system in this state. Some of the key elements are the ability at discharge to incorporate child and family supports and post-treatment supports. We're looking at the importance of the proximity to a child's community. We're looking at timely access to flexible and robust outpatient services and trauma-based services for children and families within the system that really most appropriately meets their needs. And our team in child welfare has begun coordinating with the special master that was appointed by Judge McShane in the temporary lodging settlement agreement. Dr. Byers was brought in specifically to help the judge understand and make recommendations to the judge who's overseeing the settlement agreement about what other things child welfare can be doing, what the child serving system in the state can be doing and considering in order to get to our long-term goal, which is absolutely to eliminate the need of temporary lodging. So we're really excited about the partnership that we've experienced so far with her and expect that to continue. Thanks, Tim.
Wonderful. Thank you, Lacey. We have another important update about a program that is often a support for our families. April, do you mind sharing that with us?
Of course I don't. So I'm going to, because there's a lot of information here, I'm going to ask that we put some of these details in the chat so that you all have this information. I'm just going to give some highlights. For background, employment-related daycare, or ERDC, is the largest child care assistance program in Oregon. Though it is called employment-related daycare, it covers childcare for employment, education, and families who are eligible to receive cash assistance through TANF, or temporary assistance to needy families. So we've had a lot of growth in the program, and there's been more families that can benefit, but not enough program funding to support ERDC's growth. So Oregon is going to activate a wait list on November 4th, 2023, due to the increased demand and some budget limitations. The Department of Early Learning is quickly rolling out information about plans to activate the wait list. So look forward to receiving some of that information. And Oregon is going to use this wait list to prioritize support for families with special needs. Families will skip the wait list if they're referred by child welfare, which is exciting news for us because we haven't had that ability before. So pay attention to information in the chat and additional communication that is going to be coming out about that. Additionally, families with a current ongoing safety plan can meet an exemption for the ERDC waitlist if childcare is needed in order to keep the child at home, return the child home, or place the child with a known adult. Again, a really big deal. That's a change in the work. So we will be able to work with ERDC to prioritize children receiving care when they are touching the child welfare system. As you can probably guess, this is something that supports our guiding principle number 1, to support families and to strengthen our efforts to keep them together, right? We know that child care support is one of those examples of a concrete support that can help children stay safe. So I'm going to let the details be added to the chat, and I'm going to turn it back to Tim. Thank you.
Thank you, April. We appreciate that update. We are going to get started with our question and answer section of the chat. Thank you to everyone who has contributed questions in advance. We may not have time to answer all the questions that you've submitted, but we'll do our best with the time that we have. We also want to make sure that our Q&A session is relevant for everyone. So we may be adjusting the way questions have been worded or grouping similar questions to cover the topics more effectively. Okay, the first question is for Lacey. What efforts are being implemented or considered to meet the need for foster and resource families?
Thanks, Tim. We have several efforts in alignment with our Vision for Transformation Guiding Principle 1 around both recruiting and also retaining and supporting families who meet the needs of children experiencing foster care. In 2019, the legislative session resulted in an investment of a group of folks called Champions. They are 16 staff, one for each district, whose responsibility is developing in partnership with the team in that district-specific recruitment and retention plans based on the data that indicates what kind of children live in that district. That rolls up to a statewide plan. Those are updated on an ongoing basis continually. And we're working to begin really measuring the impact of those positions. We also have a whole variety of targeted recruitment efforts that happen across the state, and then continue to work with our staff in exit surveys from resource parents to understand if they leave, why, and what we can do as employees to make sure that they're getting the supports they need. A couple other things I'd point to, in this past session, we were able to advocate for and get maintenance payments for resource parents increased. It's not all about the money, but it's not reasonable to expect that someone can do this job for children and families without being adequately reimbursed. And so I'm hoping that the increase in maintenance payment is going to lead to that feeling of support. We have completely rolled out the respite program. Again, another place that recognizes parents need respite, and so do resource parents. So we were grateful for that investment, and we've got it up and functional and running now. We have respite families certified in the state now and have children who are getting respite. And eventually, I think the information that April just shared about the ERDC employment-related daycare is important. Certified resource parents will be eligible for that support as well. And so my hope is that the increase in the maintenance payment, the opportunity to have respite, and the opportunity for employment-related daycare is really going to provide a robust platform for the parents who are serving children.
Wonderful. Thank you, Lacey. The next question is for April. April, there's a question about whether Oregon is joining the national conversation that helps us to know the difference between poverty and safety issues. Can you share about what we are doing?
Yeah, of course. I'm pretty passionate about anti-poverty and its connection to, understanding the difference between poverty and safety issues. So one thing, we could talk all day about some of the things that we have going, but the structured decision-making tool is a tool or a set of tools that help us to make more objective decisions. And I could get all into the weeds of it. Nobody wants to hear me do that. But I would love to hear from community if we want to have more of a listening session about what structured decision-making is. We have implemented our first structured decision-making tool at the hotline, and we're looking to incorporate other aspects of their suite of tools into our decision-making and practice. We actually start training in one of our family preservation demonstration sites, I think next week or the following week, around some of the additional practice tools that can help us get much more clear with families about the things that we're worried about that are safety issues and the things that maybe are complicating factors that make their lives hard, like poverty, and having those conversations both in a way that helps us to meet their needs, but that doesn't have us conflate ever what is just about poverty from what may be about safety. As we continue to learn from our demonstration sites, it really will inform how we spread those learnings throughout the state. I appreciate the question.
Thank you, April. Alicia, the next question goes to you. Is there any budget to undertake a Lean Six Sigma type of exercise within ODHS? Seems like there could be some really easy, quick wins in terms of operational efficiency and best practices.
Yeah, thank you, Tim. Thanks for the question. Just a little bit of background, our budget goes through several layers of approval, and since we are a state-run system, our positions are legislatively bound, meaning that any new positions that we have or want to have need to be approved by our elected officials. And that happens during our legislative session. And excitingly, in 2021, during our long session, we had some legislative support to build a continuous quality improvement program, including positions. And the continuous quality improvement is a systematic approach to identifying, describing, and analyzing strengths and opportunities to improve by using data to test, implement, learn, and revise our solutions. And one of these approaches that we use in child welfare is our PDSA, which is plan, do, study, act. So PDSA. And when we test out something, we implement it, we learn from the implementation, and from that learning, do we revise it and tweak it to get the outcome we're intending, or do we continue to go on that path that we've decided to do? Lean is an improvement methodology that was created by Toyota, and to improve their time from when someone places an order for a car to the time that the car was delivered, and also to keep track of eliminating waste. So how can they be most efficient in their process? Child welfare decided to use the PDSA approach because the strategies for improvement were to support people. And, we're not widgets, we're not people on a conveyor belt for, trying to turn knobs faster or have someone work on one thing and pass it to the next. We're working with humans and people, and we're complicated, dynamic, and different. And in order to do that, we had to do something that's more reflective of our work, which, I used to work in a hospital, so lean was absolutely the approach that we would take for manufacturing or hospital-based settings. But the feedback that we got when we were building out the CQI program from our community, from persons with lived experience, from our workforce, is that this was the most obtainable and applicable approach and improvement. So the CQI program is an ongoing effort to support local branches to achieve our measurable improvements in efficiency, effectiveness, performance, accountability, outcomes, and other indicators of quality. We have a federal performance measures dashboard that is publicly available that lists all of our lag measures. So those are the measures that are measured over a course of a long period of time. And that takes a little while to tweak and move and change in the right direction. However, we have identified measures that will impact our practice today so that those long-term outcomes for children, which is permanency in 12 months, recurrence of maltreatment, which we want down. We have permanency in 13 to 24 months, and it goes on to 7 different measures. So those are the ones that we are using in part of our everyday improvements in our continuous quality improvement program to help change and lever and improve those outcomes. So we'll drop the link to the chat for the federal performance measures dashboard. If you're new to child welfare, it's giving us information across the state of Oregon, and also aggregates it to the state level. So if you're just wanting to look at a state level view. Appreciate the question. We do invite persons from all over to sit down and build out those strategies. So during those learning conversations, we work through our current state and identify one particular area of focus for the course of the next 12 years. And really it's a partnership that we're here together to improve is the reason why that program works. So thanks for the question, and I appreciate the curiosity. Back to you, Tim.
Wonderful. Thank you, Alicia. Lacey, a question for you around shelter and BRS congregate care programs. What are we doing to make sure that we don't have to move kids away from their community?
Yeah, thanks, Tim. I'm going to answer that as well as a couple questions that have come in about the chat. I think one of the dynamics that happens is because today there's around 20 children across the state who are in temporary lodging, which means we're also avoiding approximately 75 children from being in temporary lodging just today. And that's only a very small portion of the number of children we have in foster care, right around 4,400 right now, that there are so many things we're required to do to attempt to avoid temporary lodging that it could create a feeling or a belief, if you're getting called every day, if you're a certified resource parent to care for this child in TL, that there is a shortage that I don't see happening in the data at the weight that it's felt, if that makes sense. So I think I just want to make sure that dynamic is clear in your minds, that while we are struggling to adequately serve a small number of children, what we do to try to prevent them from being in temporary lodging can sometimes really increase the impact of that number. Having said that, we are continuing to press on looking at where capacity can be increased both within BRS and in lockstep partnership with our child serving system partners across the state. A couple of places within BRS where we're expanding capacity right now. Madrona Recovery is expected to have more beds on board in the next couple of months. We also have a Village for One Anissa Place, expanding to a second new site in spring of 24. We're continuing to strategize where we can have those short-term shelter placements. Right now, our homeless and runaway youth funding is currently with New Avenues for Youth. So that's, and then we also are strategizing with our partners in the Office of Developmental Disability Services, and of course, our important partnership with Oregon Health Authority to make sure that we have a robust service array. The last thing I would point to with this is we are really focusing also on getting services to children and young adults rather than children or young adults needing to move to services. We have advocated for expansion of the RSN pilot project, that is service delivery that comes directly to children in their homes or in resource care when they're struggling. We also have a funding stream that allows us to write contracts specific to the needs of a child or caregiver that are very nimble and fluid. I've been across the state this summer talking to lots of our staff, and I've heard specifically those two interventions have been felt and really helped to impact placement stability. So it's not an easy equation, but it's something that we will always be keeping in our focus and directly in our priorities.
Thank you, Lacey. April, the next one's for you. We had someone share that they are a new resource family and we're curious about caseworker turnover. What improvements are we making to ensure that we're adequately paying and training staff who are able to keep up with the caseloads?
That is such a great question. So there are quite a few things that we have been doing over the last several years. We got a significant investment in the number of caseworkers by the legislature in this last legislative session. And that ask of the legislature was based on a caseload ratio that we've established for child welfare so that we can make sure that we are resourcing the right number of staff for the cases that we have, or that we're continuing to do so as as the numbers kind of fluctuate in terms of the number of children coming into care. What we've seen over time is that the typical caseworkers that you all are interfacing with, if you are resource families, we call those permanency workers. They need to have an average of 12 cases per caseworker. And what we're seeing based on our ratio is that they're pretty close to that, if not at that on average every month across the board. So we are maintaining our caseload ratio based on what we have, based on best practices across the nation. And so there are the Council of the Child Welfare League of America and the Council on Accreditation have put out best practices that informed our caseload ratio. So one, we have a ratio and a standard that we are aiming to keep on average every month that we are doing, and for those back-end workers. And then we asked for additional staffing for areas where we're working on that. Additionally, we got investments from the legislature last legislative session for a new workforce development system. So we have been completely revamping training for both resource families, and we are working on revamping all of our suite of training for our caseworkers. One last point, churn, what we call churn or turnover and filling vacancies is something that every agency has to deal with, right? And when we look at the national data, Oregon is doing very well. We are going to have a group of folks that are going to leave the work, and we are able to fill those vacancies. We continue to have more people coming to work for us, promoting, laterally moving across the agency by far than we have people who are leaving the agency. So that's not to say that every time we have a person leave, we aren't, in some ways disappointed. We've been investing in them. We want them to stay. We want to nurture them and grow them. Not everybody's going to be a great fit, and people leave the work for lots of different reasons, including promotions or leaving this side of the country. So we've been really digging into our data to also understand what are the dynamics of people who are leaving the work? What are the dynamics of how we are making sure that there are people that are still interested in doing the work? And what we're seeing is that our workforce is pretty stable comparatively. The other thing that I wanted to call out is that we have been investing in the development of a coaching model. And that coaching model really is for supervisors to find different ways to grow their workforce, to build confidence in that workforce. We also have been leaning in and doing leadership development with our supervisors. You all have maybe heard, it isn't the job that people leave, it's their supervisor that they leave a lot of times. And so we feel like we need to continue to invest in our supervisors. And I am not saying that we are finished, we are only getting started, but our methodology really has been making sure that we have a caseload standard, that we are investing in our supervisors, and that we're investing in coaching models and training to make sure that our staff are feeling invested in, valued, and supported. The new training team, we've also identified 2 trainer developers who have been assigned to each district to provide technical assistance and training support for staff and resource parents. That's a new thing that we're just trying to do to invest more in our local leadership. So really appreciate the question. There's always a question about caseloads and workloads and those kinds of things. And so we will continue to bring information to you as we review it. We do have a caseload dashboard that we review regularly to make sure that we're keeping an eye on things in terms of how our caseworkers are doing, making sure that the workload is manageable. Thanks.
Thank you, April. Appreciate that. Lacey, the next question is going to you. What efforts are being implemented or considered to help families being impacted by the increasing opioid epidemic in the Northwest?
Yeah, that's an issue that weighs pretty heavily on us as we continue to see the impact. We have a provider on track, Rogue Valley, that's kicked off an innovative residential substance abuse treatment project. One thing unique to this project is that they will have the capacity to serve fathers, mothers, husband and wife, partner, really any family makeup. And they look at a wraparound approach to serve the whole family with treatment along with counseling, parenting support, medical care, housing, really anything that a family might need. We awarded On Track a grant to fund a full renovation of their current complex. It's located in Medford. They have found an internationally renowned trauma-informed design firm. It's called Mass Design. Those folks are overseeing the renovation and really looking at creating space for family connection, and including other partners in the wraparound services on site. It will be their local CCO, substance use disorder treatment, all of those things that families may need. So that's one model that we're developing and would love to replicate in other areas of the state. We're also continuing to look at our own practice in response to families that may be impacted by opioid use in a whole variety of ways. We use a process called safe systems mapping, and we've done that in planning out better response to substance use disorder of all types. And then we're also carefully analyzing our own practice around how we safety plan with a parent who may be impacted by opioid use, what family time looks like for parents who are impacted by opioid use. The last thing I'll add is, much like some of the other things that we've talked about today, Oregon's not staying alone or siloed in our learning. We're getting really connected with other states across the country. It's something that child welfare as a field is trying to catch up to and respond to. And I'm proud to say that our child safety program created some guidance that national technical assistance folks are using to support other states as well. So we're going to stay in it, stay on top of it, and be as responsible as we can be, Tim.
Thank you, Lacey. And don't go anywhere because I think this next one's for you also. There's interest in our data around the kids in care and how we compare to other states. What's the current ratio of foster families to kids needing foster care in the last year in Oregon? How does this compare with previous years? Where can I find this data? Any thoughts, Lacey?
Yeah, the number of kids in care continues to decline. The rate at which they're declining is slowing, which we would expect. Since 2018, we have started looking at recently the ratio of number of children in care to number of total available homes. That ratio over the last 6 years has gotten better. That says to me, we're doing a good job, or we're doing a better job. We'll never be perfect. It won't let us be perfect at retaining homes, because the ratio is getting better, and we're going to keep working on it. I don't track other states' data, Tim, and so that would be one that I would ask folks to look to other states' publicly posted data to understand what their data looks like. But you can also see on a monthly basis both this data, number of total children in care, number of total homes, as well as a host of other monthly progress data. It's on our monthly progress report, and it's posted on our website. I think that link's going to be dropped in the chat.
Okay, I think we have time for one more question. And I think it's also for Lacey. Actually, a few questions were submitted around getting support to families. Can you share about any supportive efforts that we're making with our families?
Yeah, I think a couple of things I would call out, really the work of family preservation, and I highlight that for two reasons. I think that the activity and actions and supports that keep children in their home safely are also the same activities, actions, and supports that families need in order to be reunified quickly and safely. So that work, although focused on prevention and preservation, is also really informing our work around reunification as well. Two things I'll highlight that you've already heard us talk about today, and so I won't be too wordy. I think the employment-related daycare, as we get it up and running in this state, is going to be a game changer for families. We know from national data that access to safe and appropriate daycare actually prevents child abuse. And then finally, that respite program that I already referenced, that will be available both for families experiencing child welfare as resource parents and as parents of their own. And so, you know, the support of having safe and healthy people help you parent your children, I think, can't be understated. So those are some of the things I'm excited about.
Thank you so much, Lacey. You know, sometimes it feels like an hour can take forever. That hour went by really quickly. So we are out of time. We know we didn't get to all of the questions that were submitted, so we're going to make sure and follow up on those. We do want to let you know that we appreciate you joining us today, and we hope you have a wonderful week.